Welcome to the Research Centre here at Blackpool. Research is an essential part of the NHS as we strive to improve health and well-being and people's experiences of the NHS. We cherish excellence and professionalism wherever we find it, in the everyday things that make people's lives better as much as in clinical practice, service improvements and innovation. We recognise that we all have a part to play in making ourselves, patients and our communities healthier. Here at Blackpool we focus upon patients' choices and their experiences and empowering them to make their own choices wherever possible and improving the quality of their stay. Your right to choose as a patient is also set out in the NHS Choice Framework. The legal right to choice doesn't apply to all healthcare services. However, where they do, you have the legal right to choose. You should be at least offered these, depending on what's available locally, such as the trials available at this trust. Research is also a priority for the Department of Health, as it shows what works and what doesn't within healthcare. It improves care, gives efficient utilisations of resources and can save money for the trust. We can give new access to new treatments, interventions, medicines and devices, and by doing so we can find new ways to deliver care to the patients in the safest way, by always following the NMC guidelines.
What we know is that in research active institutions that the quality of care given is generally higher than those that are not research active. Over the course of the years we've developed more and more research within the trust, and over the past several years we've been one of the highest recruiting trusts in the North West to a variety of studies across the whole spectrum of the care services that we deliver. So we know that by doing research, it's an indicator that we're giving good care. It also means that if we do research, we are at the forefront of learning new techniques and the results from studies which we can translate into the care of our patients. One example is the work that we've done around clot prevention in stroke patients. We actively participated in that trial, and because we were a participant, learned of the outcome of the study earlier, and so we're able to deliver that better care to our patients in advance of the rest of the country. Every patient has a right enshrined in the NHS Constitution to be involved in research. Research is important because a lot of the care that we give, we don't know if it's the best, and what we all want is to have the best care for our patients, because one day we may be a patient. To do this, we need to recruit patients into studies, and that's where the role of the staff is important in being aware of the research that's going on, flagging that up to patients themselves, and maybe flagging it up to the supervising consultant and medical staff to suggest that a patient may be suitable for enrolment in a study. The research team based in the research centre will support activity and will be visiting the wards, and they're another point of contact for patients who may be appropriate to go into research studies. That's why we should do it, and that's how we can do it. What if we do that? Well, what we will see is that we'll have more patients enrolled in studies, we will develop better care for our patients, and they, and in time us as patients, will have better evidence-led outcomes.
For staff on the wards and the units, there are a few simple ways to identify if patients are enrolled onto a trial. Pink case notes, allergy alert cards, stickers to the front of the notes, the AMU alert tracker and Maxim alerts. Patient information sheets and consent forms are also in the case notes, along with the principal investigator details, research nurse documentation and research nurse contact details. On-call pharmacy is also available if you need any additional help out of hours, as are the principal investigators via the switchboard. Your principal investigator is always your first point of call. The most important thing to remember about research is that patient safety is our priority. In a medical emergency, please treat clinically as you would with any other patient. Document all events and contact the principal investigator or research nurse as soon as the patient is stable and you're able to do so, to tell them of any changes so protocol deviations can be reported on. However, if you think that this is linked to the research drug or intervention and you need emergency guidance, please complete either the PI or the lead research nurse for the trial to assist you in emergency care for your patient.
If patients are required to receive medications as part of a clinical trial, the research drugs will be prescribed on the hospital prescription chart or IV fluid chart. Errors involving trial medications that occur as a consequence of delayed administration, failed administration, or discontinuation of a prescribed medication are subject to the Trust Incident Reporting System and will be investigated in accordance with the standards outlined in the Trust's Medicines Management Policy. If staff on the wards have any concerns regarding research prescriptions, they should contact the research nurse responsible for the trial. Staff should also take every opportunity to familiarise themselves with the research projects that involve their clinical area.
In non-emergency situations, any changes to the research drug or pathways must be authorised by the principal investigator. This is the person that has overall responsibility for the trial within the trust, and all contact details are within the notes. Research isn't optional or an add-on to your clinical duties. It's still the responsibility of the clinical staff to carry out. If drugs are prescribed or an intervention is needed for a patient for research purposes, this must be done at the times requested or as close as possible. If prescribed drugs are not given, this will be treated as a medicines management issue and falls under the same policies as any other prescribed drug within the trust and may trigger an incident report. Here at Blackpool, we cover research in the majority of areas across the trust. It's your personal responsibility to find out what's happening in your area to ensure patient safety, a quality experience, and that parts of the protocol whilst in your care are covered to deliver a better experience. So quite simply,
today's research is tomorrow's care.